Hey guys, it's Leah B from Prestige Veteran Medical Consulting. I'm a U.S. Army veteran, physician assistant, and former compensation and pension examiner. Today I want to come on and do a video about depression and what happens in a compensation and pension exam for depression. So we've done several videos on what happens in a C&P exam in the past. They seem to be super popular and helpful. Maybe they're easing some of you guys' fears when you're preparing for those exams. So hopefully this one will do the same for those of you going in for a depression C&P exam. So let's start off by talking about how people get service connected for depression. So if a veteran was diagnosed with depression while on active duty, they experienced something and were treated for it and it's continued since service, it may be relatively a simple process, especially if it did not exist prior to service, for the person to show or establish that they were that this was directly related to their service. Okay. That's not in every case, but that's in some cases. If a person had pre-existing depression, but it was aggravated or worsened beyond its natural progression by their service, that would also be some sort of a direct service connection. On a secondary basis, a person could develop a back condition or any other medical condition that they become service connected for. Let's say you were on active duty and you injured your back really bad while you were deployed, or you had a traumatic amputation of your arm or something like that. You develop depression after that. It could be right after that or many years later. It can be secondary to a physical condition, or even another medical condition can cause it, not just an orthopedic condition. It can be another medical condition like tinnitus or sleep apnea, or just about anything if that particular condition is causing you to be depressed. Now, that doesn't mean that everybody that has condition A, condition B is related to that. It's just all person or patient or veteran specific, right? Based on your history, you could be depressed because of your back pain, but then it resolves and you get depressed because you're getting divorced, or, sometimes they can be intertwined. Okay. So we'll get off of that and we'll go on to what happens in the C&P exam. So for the most part, you should get a packet in the mail that has the DBQ or disability benefit questionnaire in it. And it also should have who your exam is with, how long they've been an examiner, where it's going to be at, what time it's going to be at, all the 5 W's, right? So once you get that, you can hopefully that DBQ will be in there, that disability benefit questionnaire. That's the document, and we're going to go over that here shortly. That is the document that the C&P examiner is going to go over with you at the C&P exam, and it sort of outlines all the questions that are relevant and pertinent to the condition. That helps the adjudicators decide what percentage you should get, if you're going to be service connected, et cetera. So again, it should be in that packet, but if it's not, you can head on over to va.gov and they should have a copy of it over there for you as well. So I'm going to just share my screen with you guys really quick so that y'all can see what I'm seeing. Okay. Okay. So let me just make this just slightly larger if I can. Okay. So this is from va.gov. This is the mental disorders other than PTSD and eating disorder disability benefit questionnaire. If you guys want to see, I have another one about what happens in a PTSD C&P exam. If you guys want to check that one out, that's a great video as well. But this one is going to be for mental health disorders, and specifically, we're going to go over depression today. So as you can see here, again, this is what they're going to go over with you at the C&P exam. So they're going to put your information up here at the top. This is all just sort of like some demographic information that they're going to fill out. That's not really questions for you. So are you completing this DBQ at the request of the veteran claimant or others? So you can take this to your regular psychologist and ask them to fill it out if you'd like, or your psychiatrist. And so that's where they would fill out some of that information. Are they regularly seen in your clinic? Yes or no. Was the veteran examined in person? Yes or no. Or was it done, like, for example, via telehealth exam? So diagnosis, does the veteran now have, or have they ever been diagnosed with a mental health disorder? Yes or no. They're going to put the ICD code. That's not something you need to really have in the back of your mind. The medical provider is going to know that. Then it asks if the veteran currently has one or more mental disorders that conform to the DSM-5 criteria, provide all diagnoses. So you know, maybe you've got more than one. Maybe you've got depression and anxiety. Maybe you've got generalized anxiety disorder, adjustment disorder. But for the purposes of today, we're just going to talk about depression. And if there's any, so it's listing for 3. If there's more diagnoses, they can put them here. Medical diagnoses relevant to the understanding or management of the mental health disorder, to include TBI. So differentiation of symptoms. Does the veteran have more than one mental health disorder diagnosed? Yes or no? Is it possible to differentiate which symptoms are attributable to each diagnosis? So this, I don't want to get too in the weeds, but this can become important if one of the conditions is sort of related to service and maybe one of them isn't, or perhaps if there's an overlap, they want to be able to determine, especially with TBI, which we're going to go down here a little bit later, is there an overlap of symptoms or are they really distinguishable? Okay. Does the veteran have a diagnosed TBI? Yes or no? And then it says, if yes, you're going to fill out 2D. So if the answer was yes, then is it possible to differentiate which symptoms are attributable to the TBI and any non-TBI mental health diagnosis? So a lot of people are combined for those. Not always, but a lot of people are combined for a mental health condition and TBI if they suffer from both. So now it's going to go on to occupational and social impairments. Which of the following best summarizes the veteran's level of occupational and social impairment with regard to all mental health diagnoses? And they only want the person to check one. So obviously, if you don't have a mental disorder diagnosis, they're going to check that. And it goes all the way from the condition has been formally diagnosed, but symptoms are not severe enough to either interfere with occupational and social functioning or to require continuous medication. The next block is occupational and social impairment due to mild or transient symptoms, which decrease work efficiency and ability to perform occupational tasks only during periods of significant stress or symptoms controlled by medication. The next one is occupational and social impairment with occasional decrease in work efficiency and intermittent periods of inability to perform occupational tasks, although generally functioning satisfactorily with normal routine behavior, self-care, and conversation. The next one is occupational and social impairment with reduced reliability and productivity. So the next one is occupational and social impairment with deficiencies in most areas such as work, school, family relations, judgment, thinking, and or mood. And then there's total occupational and social impairment. So you know this question is going to be asked. So if you have some examples like, hey, I'm late to work all the time. I'm reprimanded at work constantly. I don't get along with people at work. Maybe you're in school, right? You have been failing several courses. In social environments, are you just totally incapable of communicating with people? Try to write down some examples. That way, when you get there, you're not like overwhelmed by the process and you can provide some feedback that might be helpful. So have you been fired from tons of jobs? That's another thing. Have you quit tons of jobs? Anything like that. For the indicated occupational and social impairment, is it possible to differentiate which impairment is caused by each mental health disorder? Yes or no? If a diagnosis of TBI exists, is it possible to differentiate which occupational and social impairment indicated above is caused by the TBI? Yes or no? So now it's asking for what evidence was reviewed. What did they look at? Did they look at your claims file? Did they look at just your private treatment records? Did they look at your VA medical records, your service medical records? Did they look at nothing? What was reviewed here? And the date ranges. So this history section, so question 2A is relevant social, marital, family history, pre-military, military, and post-military. So basically they want to see, it says if this is a review exam, only indicate any relevant history since prior exam. So we're talking, you know, that's really talking about whether this is like a update exam, whether it's for a reevaluation or whatever, or a initial exam. But anyways, relevant social, marital, family history. So are you married? Are you divorced? Are you widowed? What is your family history? Did your mom have a mental health disorder or any of your siblings? Relevant occupational and educational history. So it's asking about What is your occupation? Any relevant, what were you in the military? What was your job? What is your current job? What level of education do you have, right? Relevant mental health history to include prescribed medications and family mental health. So again, this is going to be those prescribed medications that you might be on now. Maybe you've been on a slew of different medications that have changed over the years. What are you currently on? Maybe you were on nothing. Relevant legal and behavioral health history. Relevant legal and behavioral history. Did you get a bunch of Article 15s? Did you have other UCMJ action? Were you court-martialed? Have you been arrested? Were you arrested pre-service? Were you arrested in the service? Were you arrested post-service? Right? Relevant substance abuse history, pre, post, and in the military. Did you get arrested or have problems with substances prior to service? Did you have problems with substances in the service? And do you have problems now, or have you since you've separated from service? And then other. So symptoms. So for VA rating purposes, check all symptoms that apply to this veteran's diagnosis. So there's a slew of symptoms. So depressed mood, anxiety, suspiciousness, panic attacks that occur weekly or less. So this is going to be a catch-all where they check everything that's relevant to you. Okay. So you can review this list. And so if there are some examples that come to your mind, again, write them down so that you can tell them, hey, I'm suspicious. I'm always worried about X, Y, or Z. I think people are following me. I am anxious wherever I go. I have to have a drink before I go out somewhere because I'm always nervous. And you guys can read the rest of these here. Near continuous panic or depression affecting the ability to function independently, appropriately, or effectively. Chronic sleep impairment. Mild memory loss. So talk about your sleep. Do you have insomnia? Are you staying up all night? Are you waking up throughout the night and having some of that middle phase insomnia? Okay, so I challenge you guys to look over this list. Flattened affect, stereotyped speech, speech intermittently illogical, obscure, or irrelevant, difficulty in understanding complex commands, impaired judgment, impaired abstract thinking. So they might not ask you these one by one. They may just pull these out of the interview as well. They might just look at you and be able to, some of these are objective findings, meaning they can evaluate and decide, hey, this person has, let's see, a flattened affect, right? Or it could be something that you tell them and that they gather from your history. Suicidal ideation, obsessional rituals which interfere with routine activities, spatial disorientation, grossly inappropriate behavior, neglect of personal appearance and hygiene, disorientation to time and place. There's a slew of blocks here. Behavioral observations, okay? Other symptoms. Do you have any other symptoms attributable to mental health disorders that are not listed above? So a catch-all. Competency. So for VA purposes, a mentally incompetent person is one who, because of injury or disease, lacks the mental capacity to contract or to manage his or her own affairs, including disbursement of funds without limitation. So are you capable of that? Okay. If you're not capable of that, and that's checked no, there may be some implications for that, right? For you not being able to manage your financial affairs. And then remarks. Okay. So they might even say in here in some of these remarks, like, hey, the person came in here and they look like they haven't showered for a week. They're wearing mismatched shoes, right? Things that they observe. Okay. Then the person is going to certify this. They're going to sign it, put their credentials, their MPI number, their license number, and they're going to sign it, right? So let me jump off of this share screen. So I hope that was helpful. Like I said, I challenge you guys to take a look at this, to write down some thoughts, because I know, I've been in a C&P exam before on both sides, right? So I've been the veteran on the C&P exam, and I've been an examiner, and I know that it can be overwhelming and it can be just a lot. So if you're prepared in advance and you have some of these things written down, it can be helpful to your examiner to have some feedback about that, right? So I hope this was helpful, and please drop some comments. Let me know if you guys have any other requests for upcoming videos. And as always, I appreciate you watching, and please like and subscribe. All right, talk to you guys soon.